Welcome to Medical Ward, BSN 3E Group 3. This is going to be your second rotation. Welcome to NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing, Medical Surgical Nursing 2, Virtual Clinical Duty. This is going to be your second week, our second rotation. Welcome to Medical Ward, and this will be your week 1. And of course, we'll talk about case scenario with patient CD diagnosed with SLE, or your systemic lupus erythematosus. But before that, I would like to share this one with you. I am here for you. It's literally my life's work to help you grow. Before we proceed to the case scenario, please allow me to read to you our learning outcomes for this case analysis. On completion of this case study, student nurses will be able to build knowledge related to the patient's medical experience. Second is to continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So that will be the basis for our expected roles also at the end of this case analysis. Also, it is very important for us to remember our instructions on the things that you are going to prepare at the end of this case analysis. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Please follow the format of your output, especially on its font style, font size, paper margin, and paper size. Of course, I've already posted with your templates on how to submit your daily and of course your weekly requirements. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor. It is advised that you will submit all your requirements on or before the set deadline of submission. And also, you have to kindly follow this format in saving your requirements for easier monitoring. For daily requirements, you have to have your daily requirements save your daily requirements accordingly as it follows. Example is Abang underscore Yucef underscore week 1 day 1 underscore NCM 116 RLE. Then that is for week 1, and then for week 2 Abang underscore Yucef underscore W2 day 1 underscore NCM 116 RLE. For weekly requirements also, you have to save it according to this format: Abang underscore Yucef underscore week 1 underscore NCM 116 RLE, and of course it follows for the succeeding weeks. Let us now have your case scenario of patient CD with SLE, or your systemic lupus erythematosus. Patient CD is a 25-year-old married woman with three children under 5 years old. She is from Barangay 47 of Cagayan de Oro City. She is a Roman Catholic by faith. She works as an office staff in one of the government agencies in the city. She came to MRXUH OPD and consulted her physician 7 months ago with vague complaints of intermittent fatigue, joint pain, low-grade fever, and unintentional weight loss. She was then advised to be admitted in the medical ward of the institution in order to rule out her current condition. Her physician noted small patchy areas of vitiligo and a scaly rash across her nose, cheeks, back, and chest at that time. Laboratory studies revealed that CD had a positive anti-nuclear antibody, or your ANA titer, positive DSNA or positive lupus erythematosus, positive anti-SM or anti-smooth muscle antibody, elevated C-reactive protein, and erythrocyte sedimentation rate, and decreased C3 and C4 serum complement. 18 months after diagnosis, CD seeks out her physician because of her puffy hands and feet and increased fatigue. CD reports that he has been working longer hours because of the absence of 2 of her fellow workers. Her laboratory test results includes sodium of 129 millimole per liter, potassium of 4.2 millimole per liter, chloride of 119 millimole per liter, total CO2 of 21 millimole per liter, BUN of 34 mg per deciliter, creatinine of 2.6 mg per deciliter, glucose of 123 mg per deciliter, urinalysis of positive 2 protein and positive 1 RBC. CD is seen in the immunology clinic twice monthly during the next 3 months. Although her condition does not worsen, her BUN and creatinine remain elevated. While at work one afternoon, CD begins to feel dizzy and develops a severe headache. She reports to her supervisor who has her lie down. When CD starts to become disoriented, her supervisor calls 911 and CD is taken to the hospital. CD is admitted for probable lupus cerebritis related to acute exacerbation of her disease. The physician orders pulse therapy with methylprednisolone or sulumedrol 125 mg per IV every 6 hours and plasmapheresis once daily. Vital signs includes blood pressure of 86/43 mm mercury, pulse rate of 108 beats per minute, respiratory rate of 18 breaths per minute, temperature of 97.2 degrees Fahrenheit or that's 36.2 degrees Celsius. High 5 critical thinking questions. What is the significance of each of CD's laboratory findings? Number 2, given that most tests are non-specific, how is SLE diagnosed? Number 3, what priority problems were addressed in CD's at that time of diagnosis? Number 4, which laboratory findings concerned you and why? Number 5, how will CD's treatment and care plan likely change? So these critical thinking questions must have to be answered accordingly, and you have to submit that one accordingly also. Your daily requirements includes the following. For day 0, the Sunday, that is going to be your case scenario loading. And of course, for Monday, your basic requirements includes your general objective, your specific objectives, your daily plan of activities, your duty expectation for the entire rotation, your survey 1. And of course, you have to have your nurse's notes, your FDAR 1. And you have also to have an initial knowledge about the case, and that includes the physical assessment, the pathophysiology, and of course, the diagnostic tests, and also your drug study. For day 2, Tuesday, your basic requirements includes your SO, your specific objectives, your daily plan of activity, your survey 2, nurse's notes for day 2, weekly evaluation, reflective journal reading, and of course your critical thinking answers. Initial knowledge about the case, and that includes the problem lists, the nursing care plan, and of course your discharge plan. Weekly requirements, and this will be your weekly requirements that you are going to submit at the end of the week. This includes the introduction of the case, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, and of course your references using the APA style of reference taking. Deadline of submission. You have to be keen with the deadlines of the submission. For the daily requirements, for day 1, the deadline is March 1, 2021, Monday, 11:59 p.m. For day 2, March 2, 2021, Tuesday, the deadline is 11:59 p.m. Week 1, that's gonna be for March 6, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. This is my contact details. My email is jabang@xu.edu.ph. My number is 0931-042-9842. You can also follow me or have me in my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.